Acute pancreatitis. Acute pancreatitis is a sudden inflammation of the pancreas, a gland located behind the stomach that plays a vital role in digestion and hormone regulation. The condition can range from mild to severe, potentially causing life-threatening complications. 1. Function of the pancreas. The pancreas has two main functions. Exocrine function produces digestive enzymes to break down fats, proteins, and carbohydrates. Endocrine function secretes hormones like insulin and glucagon to regulate blood sugar levels. 2. What is acute pancreatitis? Acute pancreatitis occurs when digestive enzymes become activated prematurely within the pancreas, causing inflammation and damage to the pancreatic tissue. This can lead to a cascade of events resulting in local and systemic complications. 3. Causes of acute pancreatitis. The most common causes include gallstones, 40 to 70% block the bile duct or pancreatic duct, causing enzyme buildup. Alcohol abuse, 25 to 35% excessive alcohol can damage pancreatic cells and trigger inflammation. Other causes: medications, e.g., corticosteroids, diuretics. Hypertriglyceridemia, high levels of blood fats. Hypercalcemia, elevated blood calcium levels. Infections, e.g., mumps. Trauma to the pancreas. Autoimmune conditions. Post-endoscopic retrograde cholangiopancreatography, ERCP complications. Idiopathic unknown causes in some cases. 4. Symptoms of acute pancreatitis. Symptoms typically develop suddenly and may include abdominal pain, the hallmark symptom, often severe and located in the upper abdomen. It may radiate to the back and worsen after eating. Nausea and vomiting. Fever. Rapid heart rate, tachycardia. Abdominal tenderness, swelling and sensitivity in the upper abdomen. Jaundice. Yellowing of the skin and eyes, especially if a gallstone is involved. Severe cases: low blood pressure, confusion, or signs of shock. 5. Diagnosis. Diagnosis involves a combination of clinical assessment, laboratory tests, and imaging studies. Blood tests. Elevated levels of amylase and lipase, pancreatic enzymes. Abnormal liver enzymes, if gallstones are the cause. Increased inflammatory markers, e.g., CRP. Imaging studies. Ultrasound, to detect gallstones or ductal blockage. CT scan or MRI, to assess the severity of inflammation and complications like necrosis or fluid collections. 6. Severity classification. Acute pancreatitis is classified into 1. Mild, no organ failure or complications, resolves within a few days. 2. Moderate, local complications, e.g., pseudocysts or transient organ failure. 3. Severe, persistent organ failure, systemic inflammatory response, or infected pancreatic necrosis. 7. Treatment. Management depends on the severity of the condition. Initial management. Hospitalization. Most cases require hospitalization for close monitoring. Fasting. Rest the pancreas by avoiding food and fluids. Nutrition may be provided intravenously if needed. Fluid resuscitation. Intravenous fluids to maintain hydration and blood pressure. Pain control. Analgesics to manage severe pain. Treat underlying causes. Gallstones, removal via ERCP or surgery, cholecystectomy. Alcohol cessation, counseling and support to stop alcohol consumption. Triglycerides or calcium management, treat the underlying metabolic disorder. Antibiotics, only if infection is confirmed. Surgery, for severe cases with complications such as infected necrosis or abscesses. 8. Complications. Local complications. Pancreatic pseudocysts, fluid-filled sacs in or around the pancreas. Pancreatic necrosis, death of pancreatic tissue, potentially leading to infection. Systemic complications. Acute respiratory distress syndrome, ARDS. Kidney failure. Multi-organ failure. Chronic pancreatitis. Repeated episodes of acute inflammation can lead to permanent damage and chronic pancreatitis. 9. Prognosis. Mild cases. Most patients recover completely with appropriate treatment. Severe cases. Mortality risk increases with complications like organ failure or infection. 10. Prevention. Limit alcohol intake. Maintain a healthy diet and weight to prevent gallstones. Treat underlying conditions like high triglycerides or calcium levels. Avoid medications known to trigger pancreatitis if possible. Early diagnosis and treatment are crucial to preventing complications and improving outcomes.